Healthcare is probably the most complicated one in terms of the customer experience or the patient experience. First of all, it's such an emotionally charged experience, not only for, let's say, the patient, but even the families, friends, people who are closely attached to them. But you've also got lots of moving parts, right? And then there's the whole public sector, private sector part of it. So in addition to the hospitals and clinics, you've got all these adjacent partners in the ecosystem, from pharmacies, the health tech providers, the insurers, and these all kind of contribute to the overall experience that the patient has in the ecosystem. And the biggest thing I think from this is who is responsible for orchestrating the patient experience within this ecosystem end to end. Across the board, emotional satisfaction is decent, right? People are generally satisfied with what it is that they're getting. However, when we look at now what's driving trust, what's driving loyalty, what's driving advocacy, we can see that actually for most of the ecosystem, we're on a downward trajectory. Essentially is saying two things. That when it comes to healthcare, I think the basic things of what the customers want around, whether it's the medical care, the nursing care, etc. So that clinical aspect of it is working. And it's sort of the peripheries around where everything is, where the experience is breaking, and some of these trends are coming into play. There's actually a big spread from both a private healthcare perspective and looking at what's happening from a public sector perspective, right? And this kind of is bringing like the industry or that healthcare sector to this NPS. So for this benchmarking exercise, Aga Khan Hospital has come out on top with a great NPS section. And you can see towards the bottom, you've got more of the public sector hospitals kind of like dragging down the thing. What's also interesting is that you've got Kenyatta National Hospital that actually is scoring quite decent from a public sector perspective. And even from a mid-tier, if we look at the likes of Equity Afya, they're also doing reasonably well. The clinical care aspect is doing really well, right? It's the surrounding things from the patient journey perspective that people are having challenges with. So from the start of the medical journey, which is around the reception, the waiting area, the triaging area, and even once we've completed, and then we need to move on to either discharge, billing, or even going to supporting services like pharmacy, etc. Now, these are the ones that are essentially causing friction. And this for me is a very interesting thing, right? Because even if you go into any doctor's GP's office, right, you will never find an empty waiting room, right? People will always be queuing up waiting. And the reason for that is it's because they're really excelling in this area, right? So your doctors, your GPs, etc. Now, they're trusted. And quite often, they even become, let's say, your family doctors or your generational doctors, right? So the same doctors may be seeing your parents, they've seen you, they're seeing your kids, they could be even seeing your grandkids. And you're sort of willing to put up with this friction so that you get that healthcare, that quality care, the person who has the medical history, the person who understands how things work within your family, the genetic implications, etc. But these are the things that are eroding that loyalty, that advocacy, that trust. The Eyecare, we've seen that, okay, compared to the previous quarter, there's been a slight dip in NPS. Again, probably nothing too concerned about from a dip perspective, but I think the thing is that we haven't shown this here, but before here, we actually had quite a surge from an NPS perspective, and now we're kind of seeing that it's kind of plateauing. Although functionally, again, the industry is kind of doing us solid, right? If we compare side by side, the big four that stood out from our benchmarking was Optica, Baus, Lions Eye, and Omega. So all doing really well from a trust and advocacy perspective. So one thing that really stood out was around the expertise, right, from the opticians. Do they know what they're doing? And are they treating me clinically well? However, this part still remains a challenge, right? So the waiting, both pre and post. If any of you attended the retail webinar where we talked about how e-commerce is kind of complementing retail commerce, you'll see that there's a bit of that coming into play from the Eyecare perspective, where your last mile in terms of or even your first mile. Maybe I've ordered something ahead online and then I've gone to the store or the outlet to get it fitted, to get it checked, get my prescription done, and then I'm waiting for either collection or delivery service. That also seems to be working really well. The really big thing, and then this speaks to, again, the wider ecosystem perspective, is around almost like either there's a lack of clarity in terms of what's covered and what's not from an insurance perspective, or there's a bit of a pricing shock, right? So, for example, if I've gone to see an optician now, typically that check that the optician doing is covered by my insurer. But then what a lot of people don't realize is that the actual purchase of the lenses, the frames, etc., is typically either an add-on or a copay, and people are just surprised by this. Early on in the year, there was a different webinar that we ran around how insurers can communicate better with their customers, as well as utilizing the power of empathy. Right now, this becomes really important, right? You don't want to have people having these kind of surprises, and it's sort of thinking about how can I make my communication as simple and clear as possible to my customers? They know what's covered, what's not, and how do I keep on reinforcing that message? Emergency services. Now, these are kind of like your rescue ambulances. And again, if we look at what's happened from the previous quarter, seems to be quite a big dip from an NPS. I do want to say, though, this time around, and it's very interesting, we've seen a significant surge of feedback that's relating to the public healthcare space, not just the hospital clinics, but even emergency services in this case. And some of these downshifts or the downward trends that we're seeing compared to our previous benchmarking exercise is actually as a result of that increased volume from a public sector sentiment. Private healthcare sector sort of doing really well. And your public sector, we have quite a bit of work to do from an ambulance perspective. And let's just deep dive into, again, what's working and what's not. And the biggest thing from an emergency perspective, and again, remember, this is a really, really emotive experience, right? That patients and the families, loved ones are going through. So speed and reliability, as well as ensuring that the ambulances are fully equipped and handled by professionals who know what they're doing, is like your bare minimus. Some of the raw verbatim we've seen from the detractors, people who've left feedback, includes things like, well, the ambulance just never showed up. I had to jump on to a taxi to get to the hospital. We saw a couple of comments where ambulances didn't have the necessary medical equipment, even things like oxygen tanks. So this is almost like a black and white, right, from an emergency services perspective, and you don't necessarily have like a gray area in between. It's either I've had a good experience and it's passed, or it's been a complete fail. And it's almost like these are like your non-negotiables. Tech enablers, we've got two parts to the coin, right? There's all the things that's happening from the public sector space. So looking at what SHA is trying to do from a universal health coverage perspective. And then we've got these days like smart applications, Savannah Informatics, CarePay, etc., who are plugging into the health system and trying to make it easier. If we go back to that patient journey that we looked at from a hospital and clinic's perspective, what happens before clinical care comes in, and then what happens after, right? So trying to accelerate your approvals process and trying to accelerate that exit discharge billing process, right? Now, the biggest thing that we've seen is not around features, right? It's actually about just reliability of these services being available when they're required by the end consumers. And if we just look at what's happened in our last benchmarking, so really, really strong NPS from a tech enabler perspective, with actually quite a lot of variability though. So you've got CarePay sitting at your 20s, smart applications doing super well at your 75s. And a lot of this is around how does this tech enable me just to remove the friction from my patient journey, right? How can I get approvals quickly? I don't want to deal with insurance forms. I don't want to deal with cards. I want to know that when I get there, I'm processed as quickly as possible so that I can start to receive my clinical care as quickly as possible. So it's all about that uptime and the convenience. So on the flip side is again about when things don't work or when services are not available. And then what does that cause? That causes now that friction. So we start to have approval processes that are slowing down, and we are creating additional friction just because the tech doesn't work. So I think the biggest question that people, if you're in the healthcare space, is to ask yourself, who is orchestrating the patient experience across the ecosystem? Who's taking responsibility for that? How do we hold our partners, suppliers, vendors, etc., also accountable for the aspiration or the standards that we're setting from a patient experience perspective, right?
Hi, my question is on the hospitals and the NPS, and what I saw is the NPS was ranging from 40 to 20s, if I got that correctly.
Sure, minus 20 from
Minus 20 to 44. And I'm not sure if 44 is like very good. I know you said that was pretty good, but compared to the, for instance, the systems, I can see the 75s. So does that also present an opportunity for the healthcare facilities to get to the 70s, or the seems like the 40s is the right NPS for the facilities?
Now, I think the key thing to answer your question is like it's a bit difficult to compare, let's say, your hospitals and clinics versus your healthcare providers, right? Because essentially there's different drivers of loyalty, different drivers of trust, different things that erode consumer confidence, right? So your sector average for your healthcare clinics is sitting at 6. A lot of it is being pulled down by the public sector. Yeah, your health tech is sitting at around 40s, right? And then if we zoom into now what you're asking, we've got quite a big range from Khan University Hospital that was at the 44 down to some of the public sector hospitals in the negative NPS. Now, the reason why I say that 44 is a good score is that if you look at the science behind NPS, this is basically saying that you've got a lot of people who are like your brand advocates and have trust in your thing. Is it a perfect score? No, right? Can there be improvements? Yes. And I think the key thing is that whilst we've done a sector-wide thing, it's for each one of these brands to think about, if this is my score, what's really driving that score and what's really eroding that score, right? And just generalizing without going to saying that these are the problems that Khan Hospital is having or Kiambu County is having, is that generally across the board, most people seem to be doing the clinical care aspects really well, but there is friction in other parts of the patient journey that people need to look into. Purity, maybe if I can throw a question at you is, what are you doing at Penda around both patient experience, clinical care, and how do you look at removing friction from, let's say, if we take this as an example, patient journey?
So this highly resonates with me because it's the very thing that we are trying to solve for, where we see a lot of loyalty towards the clinicians or the physician. However, the processes that happen around that are the greatest pain points for patients. So, for instance, the pre-authorizations and the waiting time, and because various services have very different waiting times, and so even getting our patients to understand, for instance, when you're coming for a well baby, most likely to be very fast as compared to someone who's coming to see a dentist. A dental procedure will take like 2 hours sometimes, and our baby takes like 30 minutes. So there's a lot of perception around the wait time, the processes around the insurance, pre-authorizations, and this highly resonates with us that at the clinical care, there's a lot of loyalty. And then what we are doing is trying to solve for all the other factors. For instance, ensuring that our pre-authorization is quite seamless for the patient. They are constantly updated on the progress, training our non-clinical teams on how, in regards to maybe emotional intelligence, how you can look at a patient and know this one is starting to get agitated. How do I come in and sort of have a conversation with them or update them what is happening in regards to their visit even before they get to the doctor's room. Doing a lot of communications around the medical center where we have information right in front of the patient where they can get empowered and understand what happens within their visits, and also a lot of communications through WhatsApp. So I think as they wait, so they get updated along the way. So those are some of the things that we're doing at Penda Health. Yeah.
And actually, Pretty, I like something that you've said, right? And I think it's really, really important for people to think about, not just from the hospital and clinics, but across from a healthcare perspective. The reason why your clinical medical care is, let's call it green, right? It's that training, right? There's an accident, there's an emergency. As a medical practitioner, I know exactly what needs to be done to get the patient stable, to get them the treatment that they need, etc. The things that happen around the periphery of medical care, right? And I think that's where what you've said makes a lot of sense. There needs to be this consistent upskilling so that our non-medical, non-clinical teams are operationalizing empathy and just being a bit more human and understanding. Because the other thing is that, hospitals are chaotic places and they're just so emotionally charged. So I think what you've said is super, super important.
So for the sake of everyone, my name is Monica Mukami from Smart Applications. So thank you, Akash, for hosting us for this session around patient experience. And I think it's interesting to see the feedback around the platform providers like ourselves, around the drivers or why, those drivers. Because I think when they talk about fast approvals, I don't know, and maybe I would want someone from the hospital side to just give us maybe some more, to shed more light around it, because for approvals, more often than not, I find members, bundle us together. It's all of us together, the insurer, the hospital, and the platform. But for my sake, I would want to know, is it because the platform has issues with raising the approval or a delay, or would this be ideally something relating to maybe a hospital or the insurer? And I think, Akash, maybe in just a suggestion, in the next patient experience, it would be interesting to also put particularly the health insurances in this particular report, so that we can also just have a like for like in terms of how people are comparing us being the middleman between the underwriter, the hospital, as well as the platform. But for my sake, I'd want to understand that. It's also good to note that indeed now customers are more focused on how available our systems are and the uptime, not necessarily features. I think when you're in a tech firm, you're researching and innovating around more innovative features and products that can wow customers. But it's interesting to note that customers that's not the focus currently. It's around how available and stable is your system. Akash.
No, absolutely. And thanks, Monica. I saw a couple of hands raised, so I don't know if there were individuals who want to contribute to your question. So there was Millicent and Sakara. Please take the floor.
Yeah, this is Sakara from ASC Kijabe Hospital. Thank you for the presentation. It's a good presentation. I've learned quite a lot of things from it. I think to add on what Purity had said initially, from the healthcare perspective, a lot of issues come from the non-clinical things. That's pretty correct. And I think I agree with everyone that has spoken before me that we need to have a way of educating our non-clinical staff, people on the front desks and receptions and these things, so that they can know how to handle this kind of customers, so that they don't get agitated and cause problems at the end of the day. But again, in terms of, you might have sometimes systems in the registration desk that run quite smoothly and find queues become too long before you see a doctor to attend to you. And sometimes what we do in Kijabe is we try to decentralize clinics so that we have less waiting time, so that if a patient comes, they don't necessarily need to queue for 5 hours or more to get attended. The other thing I've seen is from the inpatient side of the story, patient being discharged. I see these things are taking a lot of time, the discharges. Sometimes it's multifactorial. They can have a delay from the doctor's end trying to put in the discharge paper ready, and then heading to the buildings and everything. So it's also a clinical and an unclinical thing, but majorly the periphery of it, as you said, actually is the major component. On what Monica has asked, I think the insurance or the billing kind of thing is multifactorial. I agree with you. It's from both the insurer and the doctors as well, or the hospital, because sometimes you have a discharge being declined because there's some omission. You don't have a right ICD-11 diagnosis. There are some things that you did not put in, and on the flip side, you have system downtimes from the insurer and all these things. So to me, I think it cuts across, because you have delay from the systems, and you also have sometimes some things that are not incorporated in the discharge that leads to the insurer declining to approve the whole thing. So yeah. But this training or this presentation is helpful so that we can all brainstorm and look at into specific areas so that we can improve our patients or customer experience.
No, sure. Thanks.
Yeah, and let me just add on to that. This or not, Monica and asked, and sometimes it's not even the system, because the process, the treatment journey, or the way to billing might have gone pretty well. And then sometimes there's a certain response that is needed from the insurer side. And when now the delay is encountered at that point, the patient relates that to the entire visit. So I think it's looking at, this is the provider side, yes, but on this other side, how can we also improve things so that we continue improving patients' experience?
No, 100%, really. And it goes back to the question of who is orchestrating the entire experience. Millicent, do you have something to add?
Yes, I do. My name is Millicent Osano. I work with Savannah Informatics, and we build connected software solutions for healthcare service providers and consumers. So for me, it's both a comment and also a question to you. So my comment would go out on the issue that we were talking about, what's driving and eroding hospital loyalty. So already we can see some of the pain points that are there, and I think as an organization we are also working to find a solution for Sankara and other hospitals to ensure that there's patient engagement during that journey. So based on our background, I'd like to ask you, Akash, what future trends do you see in health informatics, maybe from the information you've gathered, that may impact the way we are building our systems for optimizing patient experiences, especially in hospitals?
Right. Millicent, that's a really interesting question. I wish we had a futurist, a health futurist available here. But to answer your question, and I'm going to we have a whole bunch of experts sitting for the webinar attendees, their thoughts as well. The biggest thing that the consumers are saying they want is just around tech reliability, right? And I kind of want to draw the parallels to things that are coming out from the Western world, right? When people say that, for example, services like Amazon shopping is great. And why is it great? Not because of features, but it's just works when it's supposed to work, all the way from ordering to delivery to customer complaints, refunds, etc. It works so well, it's almost called a boring process, right? And I think given the underlying sentiment towards the enabling tech, it's kind of tied to that, right? Just give us tech that works all the time. It's constantly made available and just makes our lives easier. I think to your point around what else, right? I think there's a thing around how can now the tech providers use data to help the healthcare providers. And I don't know what that could look like, but just as an example, and I know that there are people who are playing around with this. So very simply, if we look at fitness trackers, for example, right? Now, a lot of people have fitness trackers. They're constantly collecting a lot of data. Now, how can we use that data to kind of continuously feed our healthcare providers, the hospitals, clinics, the GPs, etc., for example, so that your kind of care becomes more proactive than reactive? And that also, to a large extent, especially from a public sector perspective, reduces the burden, right? If you're able to treat somebody based on the data that you're getting for them, from them, without them having to come into hospital clinics, and that also then kind of solves a lot of these problems around queuing, waiting time, etc. That could be something quite interesting to think about. But again, happy to hear thoughts from other people on this webinar.